Sorry, I'm very tempted to say we look as a great research team, guys. I couldn't resist saying that. Sorry.
Okay, I think we can start. So hello everyone and welcome to all of you to the public presentation of the results of the project The Impact of the COVID-19 Pandemic on Citizens' Life, findings from international comparative study in 11 countries. The results of this study will be presented by Dr. Irina Georgieva, the coordinator of the project, and by Dr. Tela Lanta and Dr. Jaroslav Pekara, who will report and discuss the national findings from Finland and Czech Republic. Let me briefly introduce our speakers. Dr. Georgieva is a psychotherapist and lecturer at New Bulgarian University in Sofia, Bulgaria. Dr. Tela Lanta is a postdoctoral researcher at Faculty of Medicine, Department of Nursing Science at University of Turku, Finland. Dr. Jaroslav Pekara works at the Medical College in Prague, Czech Republic. The meeting will be chaired by me, Lilia Gurva, from Department of Cognitive Science and Psychology at New Bulgarian University, which is the host of this public event. The whole meeting will last about 90 minutes, and about a third of it will be a question and answer session. I kindly ask all guests to not interrupt the speakers and to mute their microphones now. If you have any questions or comments, type them in the chat room and they will be answered, or you will be given the floor to answer your question during the question and answer session. And now I give the floor to Irina Georgieva, who will present the main results of their study. Irina, the floor is yours.
Okay, thank you very much, Professor Gurova, for giving me this opportunity to present the international findings from our study today. And thank you to everyone who joined this webinar today. So I'm going now to share the presentation that I have prepared for today. Just a second. All right, so I'm going to start, and I'm sure that each of us has already heard and read a lot about this topic, and in fact, this pandemic has seriously impacted each of us. Probably many of you are still trying to make sense of what is really happening, at least I do. According to the International Federation of Red Cross, pandemics are classified as natural disasters, and natural disasters often have short and long-term psychological impacts that far exceed the degree of medical morbidity and mortality that ensues. As such, the COVID-19 pandemic is likely to have traumatizing effects on at least parts of the population. And this was one of the purposes of our study, to investigate the incidence and prevalence of mental disorders. I know as a psychotherapist that talking about the trauma is a main healing strategy helping recovery. In this context, I hope that this webinar, besides its informative purpose, will provide better understanding of what we are going through and will put some pieces of the puzzle on the right spot. And it is great that people from different countries are attending the webinar today, because we can exchange experience. Although we are fighting the same virus, we can see that national policies across countries are so different. Maybe I should say a few words about how I came to this idea to conduct this research. And all Bulgarians participating today in this webinar can recall how this pandemic started. On 13th of March last year, Bulgarian government has declared a state of emergency due to the fast spreading coronavirus. For other countries, this happened a day earlier, a few days later. There was a great deal of uncertainty, a growing fear, and even panic and loneliness, because we had to stay at home. And probably you remember how the Bulgarian ex-prime minister were threatening us from the national TV that if we don't follow the measures, we are going to collect children corpses from the playgrounds. It was like almost like in a horror movie. And at the same time, the media was constantly spewing apocalyptic news about the pandemic. And yes, we were not allowed to leave our homes, neither to visit national parks or mountains. And I felt like a prisoner at my home. And this reminded me very much of my PhD research, which was on secluding patients in seclusion rooms and how their human rights were sometimes violated. Then I thought there should be a better way to handle pandemic outbreaks. I mean, closing national parks and mountains didn't make any sense to me. And I'm very happy that I found an European institution that agreed to fund the research, and a great team of professionals who agreed to join this project. And I'm very thankful for their willingness to contribute to this project. So let me introduce them to you. First of all, this is Professor Peter Lipping from from UK. Then we have Professor Ravish. He's Professor Head Department of Psychiatry, Government Medical College in India. Dr. Telalanta, she's from Finland. She's luckily today with us. I have to say, I have special thanks to express special thanks to Teva, because she has been my additional brain hemisphere in this scientific study, always available for a brainstorm session. And then we have Dr. Jakub Lukowicz from Poland, Dr. Jarosław Pekara, who is with us today as well from the Czech Republic, Dr. Sofia Wickman from Sweden, and Dr. Marina Loševica, she's from Latvia. Professor Adriana Mihai, she's from Romania, and because I spent most of my conscious life in the Netherlands, I decided to include Belgium and the Netherlands in this study. So I'm very thankful to Nelly van der Meer. She's helped me with the translation, a Dutch translation of the survey. I'm very thankful to Vasil Bozev. I know he's with us today for conducting some of the statistical analysis, Violeta Nikova for helping with the Facebook advertising, Maria Sheretova for the organizing the finances of the project, and of course, our rector of our university, Professor Plamen Doinov, who agreed to support this project. And of course, I'm very thankful to everyone who agreed to complete the survey. So how did it start? Well, first of all, I asked my colleagues to provide a list of containment measures that have been implemented in each country, and I combined these measures, and I made a list of 44 different containment measures that were included in the survey. I'm not going to talk about all of these 44 containment measures. I'm just going to give you a few examples so you get an impression of what kind of measures have been included in this study. We have closure of preschool, nurseries, and primary schools, and this measure has affected 42% of our study participants. Then we have keep at least 1 or 2 meters away from other people, which affected 78% of our participants. Then we have closure of playgrounds, affecting 25% of our participants, recommendation on working from home if possible, affecting 48% of our participants, recommendation on washing hands more frequently. This measure affected 66% of our participants. A limited number of citizens are allowed to visit open and closed public places or to gather at home. This measure affected 54% of our participants, a ban on visiting national and nature parks. 46% of our participants were affected by this measure. Closure of cinemas, theaters, operas, concert venues, libraries, etc. This measure has affected 56% of our participants. Keeping respiratory hygiene by mandatory wearing of a mask in public places, affecting 65% of our participants. Recommendation of not using public transport, affecting 42%. Closure of pubs, cafes, restaurants, except for delivery and takeaway services, affecting 58%, and haze cleaning and disinfection procedure, affecting 55%. Mandatory isolation of ill persons for certain periods of time, affecting 14%. penalties or fines for non-compliance with COVID-19 containment measures, and it seems that 30% of our study participants have paid a fine or has been given a penalty for non-compliance. So this is just a brief sample of all the 44 measures. And you can imagine that some of these measures are really violating human rights. So we have here a violation of human rights to engage in work, in education, to meet other people, to move freely within the country or outside the country, and the right to health or privacy might be affected as well. And sorry, and why is this important? Actually, because there is one legislation in the European law, the so-called proportionality principle. And according to this proportionality principle, containment measures, they may violate human rights for a short period of time by emergencies such as pandemics. However, in this case, two requirements need to be met. The first requirement, and these are the two steps that I'm going to talk about, and any mistake made during either stage could render any public health action unlawful. Sorry. So the first requirement, or the first step, is the so-called procedural legal balancing. So according to this legal balancing, administrative actors should make determinations in a transparent, objective, and impartial manner. In order to investigate if this is the case, I included these questions in the survey. How factually truthful do you think your national government has been about the coronavirus outbreak? And do you think the reaction of your national government to the coronavirus outbreak has been appropriate, too extreme, or not sufficient? With 0 being equal to not sufficient, 5 being equal to appropriate, and 10 being equal to too extreme. The next question included in the survey: how much do you trust your national government to take care of its citizens, measured from 0 to 10, 0 being completely distrustful and 10 being very having a lot of trust in your national government. The next requirement, or the step that needs to be met in order to follow the proportionality principle, is the so-called substantive legal balancing. According to this requirement, the containment measures should pursue a legitimate objective. So in this case, we have the legitimate objective is to stop the spread of COVID-19. The next step, as well, the containment measures should be suitable to achieve that goal, be necessary to achieve the objective's legitimate pursuit. So where there is a choice between several suitable measures, the least burdensome measure must be pursued. And the problem is that before our study, there were no scientific evidences on which measure is the least burdensome. So there were completely no evidence of how these measures are violating human rights. The next criteria that needs to be met is that the containment measures are reasonable and proportionate to the end. Any disadvantage caused must not be disproportionate to the aims pursued. So it means that the negative implications of the measures against COVID-19 on mental health, on economy, on restricting human rights, on social life should not outweigh the desired outcome. So, and the desired outcome in this case is less infected people and less COVID-19 deaths to prevent hospitals from becoming overwhelmed. I would like to ask people who are following the webinar to mute their microphones. Thank you. Okay, so in order, so the questions that we were interested to investigate was, can we justify the use of containment measures against COVID-19? And in order to answer this question, we included as well other two questions, which is how effective do you find this measure to prevent the spread of COVID-19 from 0 to 10? measured from 0 to 10, and another question which was included: to what extent has this measure caused any discomfort or restricted your personal freedom and your fundamental human rights to engage in work, education, meet other people, move freely within the country, or to visit other countries? Again, measured from 0 to 10, 0 being not restrictive and 10 being extremely restrictive. In addition to this, we as well included in the follow-up assessment question: do you think that the measures to prevent the spread of COVID-19 virus have more negative implications than COVID-19 itself? Measured from 1 to 5, with 1 strongly disagree, 5 strongly agree. So we're now coming up to the research questions that we have been investigating in this study. The first one is: how effective do citizens think the different measures are? The second one: which measures are perceived as violation of citizens' personal freedom and need and legal balancing? To what extent have you followed this measure? Please try to be as honest as possible, and your answer will be kept confidential. That was the way we formulated this question. And the next research question: which opinions and demographic factors have an effect on compliance with the measures? So here on this chart, you see illustrated a number of factors that we have included in the regression analysis to investigate to what extent these factors have impact on following the containment measures. The first factor is restrictiveness of the measure, fear of infection with COVID-19, trust in national government, level of stress experienced during the outbreak, received financial compensation. If people who have lost their job or income, did they receive any financial compensation? Then we have the number of hours that study participants investigated in following the COVID news on social media or in media. Then we have different demographic characteristics such as age, gender, education, level of trust in hospital and medical care, truthfulness of the national government, reaction of the national government, if they responded very extreme or insufficient, and subjective effectiveness of the measure. The next research question that we include in this study was: what can governments do to most effectively improve citizens' compliance with measures? Now we come to the second part of this study, which is on the impact of this COVID-19 pandemic on the psychological being of citizens. And the first research question we investigated is to what is the prevalence and incidence of post-traumatic stress disorder, anxiety, depression, and panic disorder caused by the pandemic across countries. We have here again an illustration with number of factors that have been included in the logistic regression. And some of them are similar to the previous chart, so I'm not going to mention them, but I'm going to say a few words about the new factors included in this analysis. And these are essential stuff. So we had the 3 categories of stuff. We have a medical stuff, we have other essential stuff such as police, and we have a non-essential stuff. Then we have, we asked study participants, do you suffer by any risky health condition that might lead to a serious development of COVID-19 infection? And then we have, we asked them as well, have you been diagnosed and did you have any symptoms of mental illness before the pandemic? We measured as well personal resilience on a scale, on a validated scale. We asked them, have you stayed alone or with other people during the pandemic? We registered a number of hours following the news. We as well asked them, have you experienced any stressful life event during the pandemic? And we have here a number of measures of per participants, how many measures have been, each participant by how many measures have been affected. And this is important because actually we asked participants to evaluate the restrictiveness and effectiveness of the measures only if they have been affected personally. We have average restrictiveness per measure, for all measures, average effectiveness for all measures, and duration of the pandemic in days. This variable is measured from the start of the pandemic and until the day of completion of the survey, and subjective distress in the pandemic. The next factor that the next research question we try to answer in these studies, which factors are associated with the development of these mental disorders, and which, this is actually what I was just explaining, which factors and contribute most. And then we have the next research questions, is resilience a protective factor against development of mental disorders during pandemic? And what is the course of post-traumatic stress disorder, anxiety, depression, and panic disorder 2 months later after the first follow-up? So what we had is like the first assessment, which took place from 26th of June until 31st of August. And we used validated scales to assess mental state. And then 2 months later, we used the same scales to assess the mental states of study participants who gave their email address during the first assessment and agreed to participate in the follow-up assessment. This is the website.
Sorry, Irina, sorry for interrupting you. Because you have the host rights, could you take just a second to mute all the participants who are unmuted? I asked them several times, but I didn't do that. For example, Vasi, for example, is not muted.
Let me see. Yes, I'm going to mute Vasi.
I think.
And this is that all?
Is that? Yeah, okay, thank you so much, and sorry again.
No, no worries. It was very disturbing for me as well. All right, now I can continue. Right. So we have the survey. We translated the survey into 9 relevant languages. We got ethical approvals from 5 ethical committees in 5 countries. And data was collected via researchers' personal networks and via Facebook advertising after completing the informed consent. This is the picture we used to attract Facebook users' attention in order to ask them to participate in our survey. Here we have a chart with the number of respondents that completed our survey. We managed to collect 9,543 responses from 11 countries, with the highest response rate being from Bulgaria with 1,868 participants, which is not surprising given that New Bulgarian University was running the Facebook advertising of this study. So people really recognized the university and trusted it as an official institution. I'm not going to comment on all collected number of data but per country, but you see that the samples are pretty big for each country. Now we have a slide which is illustrating the number of containment measures per country, with Bulgarian government being very generous in the beginning of the pandemic and implementing 37 measures, followed by Romanian government implementing 36 measures, followed by the Indian government with 35. Then we have Polish government implementing 33 measures, Latvia with 30 measures, Czech Republic with 28, Netherlands with 27, UK with 24, Finland 22 measures have implemented in the beginning of the pandemic. And of course, Sweden, they have become very famous with their liberal policy, and they have implemented only 13 measures in the beginning of the pandemic. Now we have here findings. I find them very important, and I'm going to explain why. So you see here on the left side, you see a list of containment measures. These are the 44 containment measures that we included in and asked study participants to assess their effectiveness and restrictiveness. Okay, so you have here in yellow the level perceived restrictiveness per measure, and in green you have level of perceived effectiveness. According to the proportionality principle, the negative consequences of these containment measures should not outweigh the desired outcome. And the desired outcome in this case is the level of effectiveness of these measures. So therefore, I put here a red line, which is illustrating exactly the balance between negative effects and the positive effects. And this is exactly on 50%. So you see that many of these measures, yeah, they exceed this 50%. They cross over this 50%. So they're more restrictive than effective, okay? And I'm going to say a few words about the measures that have been experienced as the most effective and most restrictive, and least effective. So the first measure is a ban on visiting national and nature parks. Well, my impression actually, it seems from the beginning in the pandemic, it seems that it's shared by other study participants that as well thought that this measure is too restrictive and not enough effective. Then we have the next measure, which was experienced as very restrictive and not enough effective, is the police forces are allowed to request and obtain citizens' personal information from mobile providers and internet providers. This measure has been implemented in Bulgaria, in Romania, and I know that it hasn't been implemented in other countries. Another measure which has been, is actually exceeding the restrictiveness, exceeding and outweighing, the positive outcome. This is stopping of all elective medical surgeries and procedures. You see here 7.8 average restrictiveness, while the average effectiveness is 4.13. So, Martin Luther King, he said once, I have a dream. I have a dream as well. I hope that one day policymakers who are deciding on which measure to implement during pandemics, they have this chart on their working desk, and before they decide which measure to implement, they just look at it and say like, all right, maybe I shouldn't implement this measure because it's really violating human rights and people don't perceive it as effective at all. And I have to say as well, I should mention that most of these measures here listed, they don't, their objective effectiveness hasn't been investigated as well, okay? So I'm going to mention one more measure. This is the introducing a curfew order. This measure has been implemented in the Netherlands on the 23rd of January. And Dutch people, they value their freedom. And you see here on the next day, pictures from different protests in the cities of the Netherlands. So people were very rebelling against this policy. Few weeks later, a court in The Hague decided that the measure should be suspended. However, a few weeks later, a more Supreme Court, they decided that this measure should stay because they find it proportionate, right? Well, I'm really wondering what are the arguments or evidence they used to take this decision and to come to the decision of, this measure being proportionate, because I don't know any scientific evidence showing how effective this measure is on limiting the spread of coronavirus. And I have to mention that this measure was implemented in addition to two more measures in the Netherlands. And the first one is only one person is allowed to visit as a guest at your home. And the other measure is only two people are allowed to walk outside together, right? And so the Dutch people, they have been imprisoned for 1/3 of their time the last few months, but luckily today is sort of a National Liberation Day because this measure finally will be lifted. Okay, so we asked, as I said in the beginning, do you think that the measures to prevent the spread of COVID-19 virus have more negative implications than COVID-19 itself? And the majority of our respondents, 43%, think that the measures taken to prevent the spread of COVID-19 virus have more negative implications than COVID-19 itself. Important finding. Now I'm going to comment on the level of average perceived effectiveness, restrictiveness, and compliance per country. And I'm going just to mention the highest rate and the lowest rate, otherwise I will not have enough time. So we see here that the Finnish study participants and the participants from India, they were the most compliant with the containment measures. And they reported that in 80% of the cases, they followed the measures. In contrast with these two countries, Dutch respondents, they reported they were the least compliant with the measures. Here you see compliance, and with 56%, this is the lowest percentage across all countries. Dutch participants were they reported that the measures are least effective, 35%, and most restrictive, 65%. Now we have findings about citizens' opinion about national government and medical care. These are important findings, and again, Finnish study participants, they were the most satisfied with their national government and most satisfied with the medical care they receive in their country, with trust in government being 6.6 on a scale from 0 to 10, and trust in hospital being evaluated as 7.8 on a scale from 0 to 10. In contrast with Finland, Polish participants were the most dissatisfied with the national government and medical care. With trust in government, they reported 1.3 on a scale from 0 to 10, which is very, very low. And then we have trust in hospitals reported 2.9, almost 3. Bulgarians respondents were as well very dissatisfied with national government, and they reported a level of trust of average trust of 2, which as well on a scale from 0 to 10, it's not high at all, right? I'm going to say a few words as well about respondents who lost their job or income due to the pandemic. And as we can expect, the Swedish respondents, they reported the lowest percentage of people who have lost their job or income due to the pandemic, 8.4. While the respondents from India, they reported the highest percentage, so 38.5% of Indian study participants, they reported becoming unemployed due to the pandemic. And followed by Polish respondents and Bulgarian respondents. So if you look at this data, for me, there is a very clear association between implementing more restrictive measures, right, and putting strain on the economy. Because you see, Sweden had the more liberal policy toward the more liberal policy and implementing less containment measures, and they had the lowest number of people losing their job or income due to the pandemic. Okay, now the next chart, this one is illustrating the percentage of people who received COVID-19 unemployment compensation for those people who lost their job. Although participants from India reported the highest percentage of unemployment, only 9% of them, they have received any financial compensation for lost job. And They were followed by Bulgarian respondents saying that only 10%, 10.4% of these people who have lost their job or income have received any financial compensation, right? In contrast, again, with Belgian participants reporting that 55% of them have been compensated. We asked as well study participants if they have been infected by COVID-19 or experienced any symptoms, tested positive. And again, we here see a logical finding with Sweden implementing more liberal policy, but on the other side, they are reporting high percentage of people being affected by the COVID-19. Here we have the percentage for family members being infected with COVID-19, and here we have percentage of people, respondents who have experienced symptoms or tested positive for COVID-19. In contrast, again, with Romanian participants with 3.2, and the lowest regarding family has been registered in Latvia. Okay, coming to the next research question, which is which opinions and demographic factors influence compliance with the measures? What you see here is a chart illustrating the first 5 measures that have affected the most study participants, okay? And I'm not going to comment all this data, otherwise I will not have enough time. I will just put emphasis on few findings. So if we take the measure, keep at least 1 to 2 meters away from other people, then the factor that is most highly associated with the compliance or contributed to the compliance of this measure, following this measure, is the fear of getting infected. So if we increase the fear of getting infected by 10%, then the compliance with this measure increases by 10.5%, okay? And we see that this factor, fear of getting infected, it's a very important one because we find this factor significant associated with other 4 measures. The next factor significantly contributing to following the measure is the stress by the outbreak. If we increase the stress experienced during the outbreak by 10%, then the compliance with the measure increases by 5%. If we increase the trust in government by 10%, then the compliance with the measures increases by 4%. If we increase the perceived effectiveness of the measure by 10%, then the compliance with the measure increases by 5%. We found as well that females participants are more compliant by 3.5% more than males. And we found as well that older people compared to 1 year younger people, they follow the measure 1% more. And here we have 2 measures that are decreasing the compliance. People follow the measure less. The first factor is the more extreme reaction of the government. If we increase the reaction of the government on a scale from 0 to 10 with 10%, so it becoming more extreme, which means that they implement more restrictive measures or higher or more restrictive measures, then the compliance of with the measures decreases by 6%. If we increase the level of restrictiveness of the measure by 10%, then the compliance decreasing by 1%. I don't remember, did I say here increase or decrease, but it should be decreasing by 6% compliance, right? So, and this measure, more extreme reaction of the government, you can find it here and here and here and here. So it seems that the more extreme, the more restrictive measures governments are implementing in each country, higher number of measures they're implementing, the lower compliance with the measures, which is a very important finding because I think There is a misunderstanding from policymakers that they think if we want to decrease the curve, to decrease the spread of the virus, we should increase more and more restrictive measures. However, our findings are showing that this is not the case. So we are coming to the conclusions from this part of the study, and we are making the following recommendation to policymakers. They should focus their efforts on distributing more information on how effective these measures are in stopping the transmission of the COVID-19 infection, because we saw that if the higher the perceived effectiveness of the measures, people tend to follow the measures more. They should increase trust in government and medical care, because this is an important factor as well in increasing compliance with the measures. And governments should avoid extreme reaction, or should implement the least restrictive and most effective public health measures first. Governments should provide financial compensation to citizens who have lost their job or income due to the containment measures to improve measure compliance. We found for other measures that there is a negative association. So it means that if people lose their job and they don't get compensated for that, they tend to follow the measures less. And the last conclusion and recommendation is that governments or policymakers should target in media campaigns mainly men, younger and less educated citizens, because these are the citizens who are following the measures less. Now we're coming to the second part of the study, which investigated what is the prevalence and incidence across countries of these 4 disorders: post-traumatic stress disorder, anxiety, depression, and panic disorder. Again, I'm not going to comment all these numbers. I'm just going to say what is the highest prevalence and the lowest prevalence we found. So we have the highest prevalence of post-traumatic stress disorder reported in India with 41%. The highest prevalence of anxiety has been reported as well in India, with 32%, and the highest prevalence of depression has been reported as in Poland, here in Poland with 40%. The highest prevalence of panic disorder has been reported in India again with almost 90%. And if we are talking about prevalence of respondents with at least one disorder that met the screening criteria for at least one of these 4 disorders, then we found actually that the highest prevalence has been found in this is Belgium, with 57% of the population suffering from one of these 4 disorders, which is very high. What is the incidence of mental disorders across countries caused by the pandemic? So the incidence in this case, these are the new cases. People who have developed any of these mental disorder due to the pandemic. Before the pandemic, they didn't suffer from any mental disorder, okay? So you have here the post-traumatic stress disorder, with highest incidence being registered in Belgium, almost 70%. As well, depression and anxiety has been the highest incidence being registered in Belgium. Panic disorder, the highest incidence has been registered in Poland of panic disorder. And when we're talking about respondents with at least one disorder, we found that the highest incidence has been registered again in Belgium with 26%. So it seems that Belgian people, they really suffered from this pandemic. It's causing a lot of mental health problems. The next research question is, which factors are associated with the development of post-traumatic stress disorder? So what we found that the stress of the outbreak experienced during the pandemic outbreak is increasing 1.46 times the risk of developing a post-traumatic stress disorder. The fear of infection is increasing 6 times the risk of post-traumatic stress disorder. If you have had pre-existing mental disorder before the pandemic, then you're exposed to a higher risk of experience of developing PTSD. Non-essential stuff, it seems that non-essential stuff suffered more in comparison with medical stuff or other essential stuff. Then we have perceived restrictiveness. The more restrictive are the measures, or at least this is how the respondents are perceiving it, higher the risk of developing post-traumatic stress disorder. Sorry, I am going to take a bit of water. Then we have the age. The older you are, the lower the chance of developing PTSD. More hours you are investing in following the news on media or social media, higher risk of developing PTSD. Number of measures, more measures are affecting you personally, containment measures, higher risk of post-traumatic stress disorder. More you're concerned about the health of your family, higher risk of post-traumatic stress disorder. People who have lost their job, they are exposed to a higher risk of developing post-traumatic stress disorder. Male gender, if you are male, you have a lower risk in comparison with female respondents to develop post-traumatic stress disorder. The more you trust national government, the lower risk of developing post-traumatic stress disorder. And here, all these factors are explaining the 79% of the variance of developing post-traumatic stress disorder. So it is a very high percentage. Then we have the next disorder, which is anxiety. And here again, we have few factors which are significantly associated with developing anxiety. Well, some of the factors are similar to the previous findings, and these are the stress of the outbreak, pre-existing mental disorder, fear of infection. Here, fear of infection is increasing the risk of developing anxiety with 10 times. Then we have perceived effectiveness. The more effective are the containment measures, the lower risk of developing anxiety. If you have experienced a major life event, stressful major life event during the pandemic, the higher risk of developing the anxiety disorder. More hours you are watching news related to COVID, higher risk of developing anxiety. Age, again, the same relation. More trust in government, lower risk of developing anxiety. Response of the government. The more extreme the response of the government, higher risk of anxiety. Other essential staff here are exposed to a higher risk of developing anxiety, and these factors explains 80% of the variance of developing anxiety. Next disorder is depression. Again, which factors are associated significantly with developing depression? We have the same factors here: stress outbreak, mental disorder, fear, perceived restrictiveness of the measure, increasing risk of developing depression. Major life event, increasing the risk of depression. Trust in government, more you trust the government, lower risk of depression. Lost job and no compensation for that, higher risk of developing depression. More hours watching the news, again the same factor, higher risk of developing depression. Other essential staff is here exposed to a higher risk of developing depression. More trust you have, this is a new factor, more trust you have in national medical care, lower risk of developing depression. The age again and being alone, this is a new factor. If you have stayed alone during the pandemic, living alone, then you're exposed to a higher risk of developing depression. And this explains 78% of the variance of developing depression, these factors, right? And the last, mental disorder, is developing, which factors are associated with developing panic disorder. We have the same factor here, fear of infection, and here fear of infection is increasing the risk of developing panic disorder 19 times. So imagine that. Then you have the stress of the outbreak, pre-existing mental disorder, perceived restrictiveness of the measures, education, this is a new factor. So the higher you are educated, the lower risk of developing panic disorder. The more effective you perceive the measures that are implemented by the government, lower risk of panic disorder. Major life event, stressful life event experienced during the pandemic, higher risk of panic disorder. Duration of the pandemic, so we are already exposed longer than an year staying under these pandemic conditions. But we are finding the longer we stay under the pandemic, it's increasing the risk of developing a panic disorder. Number of measures, the more measures, containment measures are implemented, higher risk of developing panic disorder. And here you see, again, these factors explain 89% of the variance of developing panic disorder. So this is a table illustrating which factors contribute most to development of post-traumatic stress disorder, anxiety, depression, and panic disorder. Some of them are already mentioned. So the main factors, again, because you see that they're repeatedly, we find these factors significantly predicting all four mental disorders. And this stress of the outbreak, fear of infection, country, pre-existing mental disorder, and average restrictiveness of the measures. The next research questions, and I'm coming to almost to the end of this presentation, is resilience a protective factors against development of mental disorder during the pandemic? So what we found that the higher the resilience, the personal resilience, the lower chance of developing all four disorders. So you can see here illustrated, this is a group of people who have scored on the scale as a low resilient copers, right? And here you see a higher percentage of, this is post-traumatic stress disorder, okay, a higher percentage of developing post-traumatic stress disorder. In the group of high resilient copers, the percentage is decreasing, okay? And this trend you can see by PTSD, by anxiety, by depression, and the panic disorder, the same trend. So we need to improve people's resilience, it seems. The next research question, what is the course of PTSD, anxiety, depression, and panic disorder at 68 days follow-up? And I'm going to tell you that we found that 2 months later, the number of people meeting the screening criteria for PTSD significantly decreased. However, the number of people, and this is the anxiety here, the number of people who have met the screening criteria for anxiety has significantly increased 2 months later. So imagine we have been investigating this in August, now we are 8 months later, the numbers of people, developing anxieties are increasing, very unfortunately. And now I am coming to the conclusions of this second part of this study. What can governments do to preserve citizens' psychological well-being during pandemics? First of all, the COVID-19 pandemic has a severe impact on citizen mental health because it's causing almost 1/5 of the study participants to develop at least one major mental disorder. The policymakers and media should abstain from spreading fearful messages about the pandemic because this may worsen citizens' mental health. Media and public health campaigns should focus on elevating stress, fear, and promoting resilience. They should maintain and build public trust in public health authorities and medical care and persuade the population of the effectiveness of any public health measure during a pandemic. And governments should refrain from implementing many highly restrictive containment measures for a long period of time and should provide a truthful and transparent response to the pandemic. And the last one, additional psychosocial services and resources should be allocated to facilitate individual and community level recovery. And I already know our colleague from Latvia, she shared with us that the Latvian government already has invested 7 million euro in addition, just to manage with this development of mental disorders that has been caused by the pandemic. So thank you very much for your attention. This was end of my presentation.
Thank you, Irina, so much. And who will be the next speaker of your colleagues? Will be Taylor, Lanta, or Yaroslav?
I think they should decide. Teo, would you like to proceed?
Yes.
I think we need lady first.
Okay. Thank you. I can now share my screen. Sorry. Can you, Irina, stop your sharing?
Yes, of course. Sorry.
Yeah,
yes.
Thank you. Okay. Thanks. Okay, can you see my screen well?
Yes, we see it.
Good. And thank you, Irina, very much for inviting me here to share some Finnish experiences and all your work on this great project. It has been a pleasure to work with you. Irina gave us very thorough presentation about the whole project, but I will now focus on Finnish experiences, a bit what is the situation in Finland, some brief Finnish results from this survey, and some discussions about how Finland has managed during this pandemic period. I would like to first show you some figures about Finland that you understand maybe better our results as well. I think Finland has been one of the European countries where the situation during this pandemic has been quite calm all the time. You can see that our confirmed cases total in Finland has been about 86,000 during the whole year of the pandemic. So it's pretty low. Daily new cases during past 2 weeks has been something between 100 and 200. And in this Finnish map, you can also see that in some areas in Finland, especially in the north part, there is basically no new cases. And I will go back to this phenomenon later, but maybe you can already guess that some of Finnish areas are not so populated. This is also a situation from this week. In whole Finland, we have right now about 100 patients in hospital due to COVID-19 and 30 in intensive care. In total, in this whole pandemic period, we have had less than 1,000 deaths, which is very low, and we are very lucky for this situation. And just to remind that our population is only 5.5 million, so it is the smallest, I think, country from our 11 countries that participated in this survey. Maybe Latvia is a bit smaller, but yes, one of the smallest. I would like to also share with you the situation that we have right now. The main strategy right now to stop the pandemic is through vaccinations. And from our adult population, we have managed to give vaccination, the first dose, to 1/3 of our citizens. And we have an aim that 70% of our adults would be vaccinated by the end of the summer. And right now, the situation is that we have about 2 months for this goal. So we are progressing quite well. I got mine 2 weeks ago. Then about our results, and these are quite brief and general, but there are something I think different to other countries that Irina just presented. Well, this is a bit of repetition that we already saw, that we have about 550 participants, and when we looked at Finnish data, it was actually only 9 measures out of these about 20 that has affected over 50% of our participants. So these experiences that Finnish people had, they had not been affected that much with the restrictions. And it was obvious based on Irina's very good slide that our number of restrictions was one of the lowest. So Finns had the most trust in the hospitals, that they are taking care of the citizens. They also had more trust in national government. And also they found among a couple of other countries that the government response was the most appropriate one. And we also had highest, or one of the highest with India, compliance with all of the measures that we have implemented. So about these restrictions, there were not anything surprising in our individual data that I would like to show to you. These are the main points. Females followed the restrictions more carefully than males. That was similar to our international results. Those who trusted government had more compliance. That was the most effective factor, that if people perceived these restrictions as effective, it was as high as 28 times that it increased their compliance. So this was very big part of the Finnish compliance. And those also who felt little discomfort were those who were committed to follow the restrictions. But here you can already see, and it comes to the next slide as well, that fear of getting infected or stress were not factors in Finland that affected to compliance. My next slide is about mental symptoms. And here you can also see in a quick look that the fear and stress is also lacking from here. In general, from Finnish citizens who responded to our survey, 11% about had, let's say, positive score from our screening instruments that were new symptoms, not previous to pandemic period. I listed these as protective factors and risk factors, and I don't have here resilience, because to finish follow-up where we measured resilience, it was quite few who responded, and I have a very good master student, and they are analyzing this data that is not very large. They have a good sample there, but I don't have it in here. But for the most of these psychological symptoms, you can see that trust in government also was a protective factor against depression, panic symptoms, and anxiety. We can also see that age in terms of post-traumatic symptoms and anxiety was the thing that more you get age, the less you experience symptoms. And it can be explained by resilience that increases over time. Being essential worker was a protective factor in terms of post-traumatic symptoms. What were the risk factors? Well, the most clear one was previous symptoms, and it was most evident in panic symptoms, where previous psychiatric symptoms increased risk by 5.5-fold. These individual symptoms that increased risk, for example, discomfort due to not shaking hands, increasing risk for post-traumatic symptoms, that is not very easy to explain, or discomfort due to washing hands. But it can be so that because there were so few restrictions that we included these models, that it is more like a representation that this feeling of discomfort due to very common restriction is increasing also mental health symptoms. Living alone was also in our data risk factor for depression. So very similar results, but something different. Lack of stress, lack of fear. But it can be so that because the pandemic period has been quite stable still here, we haven't had complete lockdown, for example. All the shops have been open all the time. We have allowed to move around, go to natural parks. Restaurants have been open, or the takeaway has been at least available. Only gyms and other sports facilities have been closed at some times. But this pandemic has restricted quite low levels our lives. So maybe that is why we don't have that much fear and stress. I have last part some possible explanations how Finland has managed quite well due to this crisis. Finland has been recognized in many international journals as well, that what you have done there, you have had so few restrictions, but still the cases have been low. The society has been kept open. Economy is still going okay. So what you have done there, what is different to other countries, and especially to Sweden, which is our neighbor country, where the situation is still terrible, very terrible. Well, I have some ideas here that have been discussed also somewhere else, but some of my own explanations. Here is again a Finnish map, and these gray areas that are in this map, they are places in Finland where there are no COVID-19 cases. So Finland is very sparsely populated country. You can see the darker the color is, more there are cases, and our capital city area is in south part of Finland, and there are all the, let's say, big cities, which means in Finland that, for example, here in Helsinki, in the capital city where I live, there is about 500,000 people. So that is big in Finland. So it's very easy to keep distance. And our families are very small. Almost half of Finnish adults live alone. And we know that many of infectious diseases and COVID-19 as well, they spread easily among families and friends. But if you are living alone, there is not that much chances to get infected. And size of our households is also less than 2. Also previously it has been noted that in Finland, level of preparedness for crises, wars, pandemics, it's in very good level. And it has been also written to our law before this pandemic that we have a special circumstances that can be taken in place when the pandemic might come. So we are very prepared to national crises, and we are a very united country as well. Finnish people trust on their government, they trust on police, on army. And one thing that must be noted that we are united maybe because it is not that easy that we have got our independence. We live next to Russia, so there is a constant fear of something happening to us. So we are always prepared for catastrophe. That is always on our minds because it is only 100 years that we have been independent in Finland. And also we have one of the best healthcare systems. For example, Lancet published a study a couple of years ago, a global burden of disease study that stated that Finnish has one of the best healthcare systems. So of course, our resources are very good compared to many countries. So that is also something that we can be lucky to have these systems before the pandemic. I will end, this is very serious topic, but I will end this to a cartoon because I know that the Finnish nature is very different to, for example, to Bulgaria. We are very introvert. So this is a cartoon, Finnish Nightmares. And when you want to leave your apartment, but your neighbor is in the hallway, we will wait behind the door that there is no one outside because we don't want to talk to anyone. So this is how we are, we Finns, and that has protected us quite much. So thank you for your attention, and there is my email if you have any questions. Thank you.
Thank you so much, Dr. Wanda. And our next speaker will be Dr. Pekara, Jaroslav Pekara. The floor is yours. And please unmute your microphone, Jaroslav.
Okay, it works. And thank you for Tela that we are witness that in the world is one country where it works despite the COVID. You can see my presentation?
Yes, we see it.
Yes, okay, perfect. Good afternoon, and thank you for invitation. And I must say at first that our college and me, we are very proud of that we were and we are a part of this great study. And I'm a lucky man that I can collaborate with great researchers like Tela and our leader Irina. Thank you again. My name is Jaroslav Pekara. This is a mark of our medical college here in Prague. Prague is capital of Czech Republic. I am a head of paramedic department. I'm a nurse and general nurse and ICU intensive care unit nurse and paramedic. And I'm lead paramedic department here in medical college. We have 3 bachelor programs. 3 years for nursing, midwifery, and paramedic study program. And my aim is professional communication, prevention of violence and self-protection, non-violent self-protection. Currently, I'm involved in several projects of psychiatric nursing, and that's my point. Briefly about Czech Republic. Czech Republic, also called Czechia, a country located in Central Europe. The majority of the population speak Czech as their first language. It's my apology about my English because my right language is Czechia. A region of rolling hills and mountains, Bohemia is dominated by the national capital Prague. Set on the Vltava River, this picturesque city of bridges and spires, the unique work of generation of artists brought in the by rollers of Bohemia. The country is bordered by Poland to the north and northeast, Slovakia to the east, Austria to the south, and Germany to the west and northwest. This is some pictures from Prague. You are welcome, everybody. But be aware, these pictures are from COVID situation. There are no people, and if you will come, you must expect that there will be a lot of tourists. Okay, and about COVID-19 in Czech Republic in years 2020 and 2021. The first confirmed cases in the Czech Republic were reported on 1st March 2020. On 11 March, the government declared a state of emergency. It means like a little lockdown. For the first time was in the country's modern history for the area of the entire country. And some measures under in parks and open countryside, as Irina mentioned. A general closure of services and retail sale was in place from March until May last year. However, all shops could conduct social distancing sales with delivery through makeshift takeout windows, and the gradual opening of selected shops started in several waves from March 24th onwards. Fear, anger, and hopelessness were the most frequent traumatic emotional responses in the general public during the first COVID-19 outbreaks in Czech Republic. As you can see on the pictures, Czech people couldn't keep the distance. In the picture in the left high corner, and in the first wave of COVID, we had no protective equipment for people for general people. A lot of people help also medical staff to make and homemade the cover mask, homemade and distribute it to the hospital. Also here in Czech Republic, where a lot of demonstrations, we can see one picture. And for your information, this year from February to April was where every Sunday in the center, in the biggest square in the center, regular demonstration for people who didn't agree with restrictions, and this is one of factors why the Czech Republic was on the top with deaths of people in COVID-19 this year. We prepared also military hospital in one sports area, but we didn't use it. the why is the politics conditions why we didn't use the army hospital. By April 2020, this year, the Czech Republic has recorded the highest confirmed death rate in the world. There are some root cases. The first one is the success of the early lockdown in March last year. The people felt like nothing bad had happened and that the measures, which came at a huge cost, were not necessary. This is known as a paradox of success. Then during the October 2020 elections, politics did not prevent the population from violating restrictions. A lockdown was decided on November last year, but we must realize that the lockdown we did on the first wave on March last year, it was one real lockdown here in Czech Republic. The next lockdowns in Czech Republic was very lightly, and I can say that it wasn't lockdowns anymore at this time. The industry is going from November last year to this day without permissions and without restrictions. We had only one lockdown last March, and from March to April, 1 month. And after this period, we have no lockdown here in Czech Republic. But maybe from the news you have information about lockdowns in Czech Republic, but there was only one lockdown, and we can see now the people who died on the right corner. This is I updated this slide in the morning, and every day last week I count death from 20 to 50 people per day, and the process is still going. It's not good here in Czech Republic. And if you realize that the Czech Republic has over 10 million people, that the death people is horrible number. And I know from experts here in Prague, from epidemiologic and virologic experts, that if we did a lockdown in November or in December, the number could be 15,000. Okay, and it's not good news for you. And about vaccinations, we have the number 2 millions, or maybe tomorrow will be 3 millions, but it's not speed vaccination. We maybe in this we have same problem like several countries in Europe. Vaccination. We have a few vaccines, etc. problems. And there are a graph about confirmed cases. You can see that the situation is getting worse from the November. Then we did a small lockdown, but not really lockdown, and the horrible period was in the March this year. There is a blue line and the red line. A red line is numbers of patients in intensive care unit, and I can tell you that in March and in April, start of April, here was like in Italy scenario. We had a lot of problems with medical staff and ventilators, with oxygens, etc. And the blue lines is people in hospital, and we also needed help from hospital from Austria, Germany, Poland, and Slovakia. There is a picture from the Staroměstská Square. It's intention of Czech scouting children. We can see crucifix of victims, dead people during the COVID, and it's only possible way how can we show how this situation bad here for our government, because our government failed this situation. This is very interesting table. I found it on Monday evening, and we can see cases in the Czech Republic by sex and age. And I'm sorry, I cannot find update for this new months. And as we can see, many cases was for men in the age period from 25 to 54 age group, and a lot of cases were bad for women. And we can see the death, and I count it yesterday, and it's statistics significant that women is worse in this pandemic situation here in Czech Republic. I wonder that what next number after April, and I can try to fill this table and send you by email. I think this is very interesting. About our intention in great articles, and I really recommend this first publishing article, and I think you must read it and to inform what this 10 great people did during this crisis. The first part, we collecting data from over 700 people. In the second part, 400, at least 500 people. And what is the interesting for Czech Republic? This data is from the mild period. It was from first wave, and Czech respondent experiencing the lowest stress level. And our group were predominated women with high school and with bachelor and master degrees. A lot of people lived at this time of this study with relatives and other people. And what is the most significant level that Czech Republic has or had highest probability of PTSD, 3 times higher compared to Bulgaria, and 4 times higher compared to Bulgaria, the PTSD probability of PTSD. I don't know what people in Bulgaria do better than in Czech Republic. I'm curious on discussion, and this is my question for you, Irina. Thank you. What is very interesting, according to a lot of participants experience there is a low stress level. We can see that 11% had depression, 15% anxiety, 5% panic attacks, 2% post-traumatic stress disorder, but in difference with another countries, maybe high. And I aimed on 4 points in this scale of nervous, worried, feel down, and distress. And you can see that about from 8 to 15%, we can see that Czech people had problems. about results show that following countries, we have also problem with depression, as Irina mentioned. In the first wave, I found also another study. Maybe this study was aimed more for physicians, medical doctors than nurses. And as you can see, this is a cohort study with 3 controls, 3, 6, and 12 months, and it contains social demographic data, job inquiries, COVID-19 concerns, and a general health questionnaire, mental health inquiries, and social conditions. And first round, my colleague had in this study 1,416 were included participants, women predominated, and physicians, nurses, and senior health professionals was the main group in this study. And despite this this data was not significant on significant statistic significant level, but it is warning that despite the mild course of the pandemic in the Czech Republic, from this study, almost 28% participants answered they felt stigmatized or discriminated against because of the pandemic. And what workers lacked during the pandemic, and the most frequently mentioned lack of appreciation, recognition, and gratitude, the fact that work in every non-standard conditions and with constant changes was taken for granted. Some mentioned the lack of support from the leadership of their organization, lack of personal protective equipment, especially at the beginning of the pandemic, provisions of physical needs, rest, time to eat, drink, and babysitting support and assistance. And I must say that these studies, a lot of studies, and especially our studies in these 11 countries, is very helpful, because understanding the view of health professionals is very important to the creation of specific support programs, whether psychological or purely practical. This is one of the aims of the studies. Worldwide, the pandemic has shown how today's society needs functioning health system without being achieved at the expense of the extreme exhaustion, specific physicians, nurses, social workers, and others. In many countries, discussions are already underway in the creation of burnout prevention programs on the need to change the overall approach. To health and social care professionals, we need to pay much more attention to their working conditions, including reducing time and other workload. It's all today from me. I hope I feel your wishes, and I'm here for your questions. And don't hesitate. Ask me what you want. Thank you for the invitation.
Thank you, Yaroslav. Thank you all of you for the wonderful presentations. Unfortunately, the time of our meeting almost expired, but we have some time for a few questions. So those of you who want to ask a question or make a comment, please just type Q in the chat or raise your hand, and I'll give you the floor. Any questions or comments?
I'm sorry, I had during my presentation a question for Irina.
Oh, okay, Irina, go on.
Did you remember it?
Yes.
Oh, okay, thank you.
Yes. Right, thank you for this question, Jarek. Well, the question was about how come that Bulgarians don't suffer as much as people from Czech Republic from post-traumatic stress disorder, right?
Yes, exactly.
Yeah, all right, so it is a very good question, I have to say, and I have huge difficulty to answer that. Actually, this morning I had an interview at the Bulgarian radio, and everyone was expecting actually that Bulgarians are suffering a lot of mental diseases. So when I mentioned that Bulgarians are actually you know, what we found, we are actually around in the middle. Let's say Finnish people are doing great, you know, but we are somewhere in the middle. And yeah, well, everyone is surprised. Me too, by the way. So I'm really, I have difficulty to say that, maybe because for many years, Bulgarians haven't used to get a very well trained and a very well organized psychosocial help. So Bulgarians are used to take care of themselves, you know, in a different ways. And this is very diverse across families and people and stuff like that. But I guess they don't rely on getting any mental health support from outside. So probably if we talk about resilience or something like that, I have to check if Bulgarians are scoring high on resilience, you know, regarding other countries. But this is the only explanation it comes to my mind, honestly. Like, I don't have any idea.
It was very comprehensive. Thank you.
You're welcome.
Okay, other questions or comments? While waiting for some more questions, I want to ask something. How do you plan to disseminate your results? It's very important for them to be present to the policymakers, as you mentioned. So do you plan some special actions to do that? To make your results available to the policymakers in all these 11 countries, but also in other countries from the European Union?
Yes, very good question. And well, first of all, I think the main way of disseminating research results is by publishing them. And of course, we have our first study has been published already, and the second one probably, I hope, in a few weeks will be published as well. And then we hope that the policymakers, they show interest toward our study and they read it. And there is no guarantee they will read it, of course, we understand that. Well, the funding that I have been used is expiring actually now this month. And if I get any invitation, or I'm sure that if my colleagues get any invitation to present findings somewhere, we are going to go for it, right? But in general, yeah, well, for now, there are no other plans, I have to be honest. Yeah.
Okay, thank you. Other questions or comments?
I would like to say, to ask Jarek, by the way, when I listened to your presentation, it came a question to my mind. You said we had one lockdown just in the beginning of the pandemic, right? And
Yes.
do you explain the increased number of dead cases in your country because your hospitals were overwhelmed? Your medical staff couldn't manage to deal with the number of people infected?
Yes, but there was no support from government, because after first real lockdown, the government promised people that it was first lockdown, and don't worry, we don't need any lockdowns.
Oh wow! Okay.
And there is we are in the period before the I don't know, how can I say, before the elections. Before the elections, and
Yes.
maybe government listened people except of hospitals.
Right. So you say actually that the policy in your country was the politics they implemented country that is very how you say more liberal just because there were elections.
Yes.
Yeah. We noticed that in Bulgaria as a tendency as well. Just before the elections, you know,
we are still post-communist country.
Yeah,
okay,
we
and sorry for interrupting you, but
Yes.
we have a question in the chat room from Zornica Ignatova. Zornica, do you want to speak on the microphone? Could you unmute and speak and ask your question on yourself? Or should I read it? Okay, I'll read it. I have a question about the panic disorder. I have a female friend who starts getting panic attacks during the pandemic situation. She had suffered from it 20 years ago, and now in the meantime, could you recommend some kind of intervention or therapy especially effective to corona panic attacks, so to say?
Yeah. I could try to answer. It's a very good question, a very interesting one. First of all, thank you for this question. First of all, what we saw as well from our findings is that indeed people who have suffered from pre-existing mental disorders before the pandemic, they were exposed to much higher risk of developing panic disorder, anxiety, depression, etc., etc. So it is indeed the case that this pandemic triggered the old trauma. So even if people had been sort of recovered for a certain time of period, you know, the whole stress and the whole restriction, etc., they were really triggering the old trauma, and people developed again, you know, the previous symptoms. And my suggestion, because I work as a psychotherapist as well, is just to look for a good psychotherapist, because it doesn't really matter if it is a panic attack related to corona or to something else. It seems that she was not healed well, you know, from the previous trauma. And you know, panic attacks, actually the good news is, at least this is my experience, usually after first or second sessions they really stop. Of course, there is a underlying mental problems, and that needs to be worked on for a longer period of time. But if it is possible to help, and I do recommend psychotherapy, because yeah, for me, psychiatric, I mean, medication, it's really suppressing the symptoms.
Okay, thank you. Other questions or comments? In fact, a last call for questions or comments.
Yes. I think Sophia is with us, right? Sophia, she's from Sweden. You're very welcome.
Yes.
Sophia, yes, great. I'm so happy to see you. I'm happy that you joined. Can you say a few?
I just wanted to say I'm so sorry for being late. I misinterpreted the starting time due to the time zone. So I'm very happy to see you all, and I hope to perhaps get to see your PowerPoint afterwards.
Sure, I can send it to you. No worries. I was just wondering about, you know, Sweden has become popular about this liberal policy during the pandemic. You know, what are the opinions in your country? Are people or the policymakers still thinking that this is a successful policy, or they think, okay, if we have another chance, we are going to do it in a different way? What is the public opinion at this time?
I think that the public opinion is very diverse about this issue, but we haven't been so liberal as the general image in international media, because we have had not lockdowns, but we have had very strict recommendations. And I haven't been, for example, at my workplace for more than 1 year, and I haven't traveled to visit my parents in 1 year. So the image is not really true. But we have had, as Tella said in her presentation, much more death cases in Sweden, but that is also due to the structure of the care of the elderly people. We have a lot of elder that that would have died anyway because they are so old and they are very vulnerable. So the organization of the healthcare of the elderly people is a big part of the big difference in death cases and death tolls in Sweden, I think. But one thing in Sweden, we are rated the most scared, and that is interesting because the Finns, our neighbors, are the least scared. So at least one of the least. So I think that our result could be disseminated more, and I just wanted to say thank you for conducting this study.
Thank you for participating. Thank you very
Thank
much,
you.
Sophia. Thank you.
Thank you again. Other questions or comment? Really, the last call for questions. So if not, let's thank again all of our speakers. Thank you so much for participating in our public event, for presenting the results of this interesting study. And I really hope that you find ways to make this data more available to more people, especially to policy makers. So have a nice evening and hope to see you again.
Thank you, Lily, for moderating this meeting so well. Thank you very much, and have a nice evening to everyone. It was really great pleasure for me to speak with you all. And thank you to the audience for being patient.
Okay, bye.
Bye. Bye. Thank you.
Bye-bye.
Bye.